This is your tick kit. It's your tick removal kit. It's from Tick Check. I'm not sponsored by them. I just like them. I have one in my diaper bag. I have one in every car, and I have one in our laundry room. And if you're saying, Julianne, that sounds excessive, I would say then you probably don't know someone with Lyme disease, because I would call this preventative medicine. We really want to prevent getting bit. And if we do get bit by a tick, how do we safely remove the tick? Now, this tick removal kit comes with two types of tools. This one is for tiny ticks and nymphs. It also comes with a little card. So if you're like, I'm not gonna be able to remember this, it comes with a card. So we're gonna pretend that this freckle on my hand is a tiny, tiny tick. So you go in horizontally, you grab onto the tick as close to the head as possible, and then you pull up and back like this. Now, by doing that, you're less likely to leave parts of its mouth or head in you, and that's where secondary infections come in. Now, if it is a larger tick, an engorged tick, you're gonna use this scoopy thingy. You're gonna go ahead and scoop them, trying to get their head to fall into this divot here. And then you're going to pull up and back in the direction that they've latched in. So if they've latched this way, we're gonna come at them from here, up and back like this. Now, why do we do that instead of just going and grabbing them and taking them out, like just putting pressure on their body and taking them out? That's because when they get stressed, they regurgitate. And regurgitation is something that happens during a full feed, but also when they're stressed. That will heighten your chance of transmission of infection when they regurgitate. We're gonna be worried about things like co-infections, Borrelia, Bartonella, co-infections. These, we don't want to be stressing them out. Now, other people say if you just put essential oils, they'll like pop off. Do not do that. Do not do that, because that stresses them out and they will regurgitate in you. So we're going to use the correct tool, and we're going to either get close to their head and hold on to them and then rip their whole everything out, or we're going to scoop them out. We are not going to put pressure on their bodies without a plan. We are not going to aimlessly just pluck them out, leaving fragments behind that can have secondary infection. We're not going to put a topical chemical or essential oil on them, which will make them regurgitate inside your body. No. We're going to get a tick removal kit, and we're going to keep it in the car, in the laundry room, all the places that you need it, in the diaper bag in our case, because that's always with us. And you are going to be smart. So if a tick bites you, you're going to know what to do.